DNA, and when they get a defect in them, then they can start multiplying, and eventually that makes a tumor. So you can see these are normal cells, but these are cancerous cells. So when they start breaking off and going into your lymph system and your bloodstream, then it can carry cancer to other parts of your body. So what causes it, we don't really know. That's the reason it's a big problem, is because you can't stop it if you don't know what has caused it. And then mainly it affects women. Men do get breast cancer, but it's mostly women. And these are all the areas that breast cancer can spread to: your brain, your lung, liver. Did your grandmother have other cancer?
That's what it was. It spread to her brain.
Oh, man.
They told her it was clear, but it wasn't.
Yeah. So it can be really serious if you don't catch it early. That's the reason we're doing this, is so that women can get tested early. And by the time you usually find breast cancer, it's been there for a long time, once you actually find a lump. So, some of the statistics are 200,000 new cases are diagnosed each year. And then the growth rate of cancer depends on the type of cancer it is. There's many types of breast cancer. The main risk factor is age, 50 to 60. Most of your diagnoses are in that age group, but we want you to start getting breast cancer screenings at age 40. Actually before that, but your mammograms at age 40. And 1 out of every woman will get diagnosed with breast cancer. And there is the lady for the main risk factor being age. So your age, starting at 40, we want you to have mammograms. Being a female puts you at high risk. If you have a mother, a grandmother, sister, an aunt, a family history of those, which you do, so that's a good, indicator that you need to get tested. And then using birth control pills, or if you use estrogen and hormone replacement therapy in menopause, then that puts you at high risk. Also, obesity, which you're skinny mini, so you don't have any problem with that. And then the BRCA gene, as you said, your mom had got tested for that. So if it was positive, then that puts you at high risk. That is a $4,000 out-of-pocket test. So, but if it had been positive, then the rest of the family could have got checked for $300. So, if you start your period before age 12, or if you're later in life, start your menopause. And then, of course, with everything, alcohol and smoking increase your risk. If you don't have any children at all, or if you have your first child after the age of 30, your risk is increased. And then 2 or more close relatives, such as your mom, your grandmother, your aunt, your sister, that have either had ovarian or breast cancer, puts you at higher risk. And then some of these we can do something about, such as our weight, smoking, drinking, but unfortunately we can't change our family history and those type things. And you can not take birth control pills, but that's really just what's best for each individual, what they do with that. So what we can do about being high risk is we can start getting our breasts at age 20. You can start doing your clinical breast exam by your physician when you go get your yearly checkups, and also you can do your breast exams at home, usually about 2 weeks after your period, because we're all kind of lumpy and bumpy and sore, so you want to do about 2 weeks after. And then starting at age 35, you need to get a baseline mammogram, just so that if any changes were to occur, you would have that baseline mammogram to know where you started at. And by the age of 40, you need to get them every year. And then continue to do your self-breast exams at home, go get your annual checkups, and that sort of thing. And then, of course, you want to have a mammogram every year after age 40. That's just a little cute picture that's... Oh, yes, I have had my mammogram. And then when you need to call the doctor, we've got a little model there, a little model breast. If you want to feel around on it, there's some lumps and knots in there that kind of give you a feeling of what they feel like. If you have any kind of firm tissue or change, some people get a different texture in the breast or under their arm that you want to check and call about. If you have any discharge other than milk, then you need to give them a call. If you have any inversion, like your nipples pulling in all of a sudden, then you need to call. And then any itching or burning or any flaking off of your skin, that's a sign as well. And then also if you just have any change in the breast tissue, if they get larger or they get a little bump in it that that you need to call. So if you did have a problem and you went in, you would get a clinical breast exam. The doctors want to examine you and make sure that what you're telling them is actually what they're seeing. Of course, they're going to want a mammogram. If you haven't had one, then it would be more like a screening. But since you're having problems, then they would do a mammogram and maybe need some additional views. The radiologist would read it that day and tell you if they saw something. And then they might even want an ultrasound. Okay. If you're having an issue, then they'll come in there and say, hey, we found this, or no, everything looks good. If you were just there for a screening, then Lourdes actually calls you the next day, so you don't have to wait 2 weeks from your physician to say everything was fine. You know, everybody gets anxious about that. And then if something did come back and they saw something such as calcifications, which just kind of looked like little spots on the mammogram, then they would have to do a stereotactic biopsy. You know, have any idea what that is? They put you on a table and they put your breast through a hole, and then they put you in the mammogram and they use a little machine that goes in, they numb it up and go in with a little machine and takes out pieces of the breast tissue, and it gets sent to the lab, and the pathologist will read it, and it takes about 3 days typically to get those results. And then they may want more mammogram views. If they saw something, they may want different angles to make sure, and then a consult with your physician to tell you what's going on. So if they did find something and it was cancer, then you'd go see a surgeon. He would give you your options, such as may need surgery, a lumpectomy. Some people need bilateral mastectomies, radiation, and chemo. Those are all treatments for breast cancer. And everybody needs support, whether they're going to get their first mammogram or if there's a problem. You know, we all get anxious and, you know, scared because breast cancer is a serious disease. So your family and your friends, your husband, you know, all church, if you have a church family, those are all great support systems. Lourdes and Baptist have nurse navigators now, and they are wonderful. As you can see the little pamphlet, you can take one of those if you haven't already, and it gives you information on, they help with emotional support. It's got some statistics on the back of it, and what to check for and that sort of thing, and what ages you should do things in case you forget what I told you. But it's a great program. They're with you through the whole process. And then there's a Kentucky Pink Connection. You can go online and look at that. That's a great state resource because they help women after chemotherapy with wigs. Some people can't afford mammograms, and they help with that. They also help with transportation and child care during chemo because some people just don't have anything to do with their children to go get these treatments. So it's a great resource. And then there's many breast cancer support groups, you know, through the hospitals and through church. And these are just some areas that you could get more information. Do you have any questions?
No, thank you so much.
You're welcome. You're welcome. I hope that helped.
Yeah,
Oh,
that's awesome.
thank you.
And they saw something, and they had her come in and done the biopsy. And when they done the biopsy, she called and told us that the doctor said it didn't look good. So when she got her results yesterday, it was.
So they did biopsy. Did they do the needle biopsy? Or?
She did say.
Didn't say. Yeah.
And-
So have they told her her options?
So,
Okay, go. Hi.
hey,
Would you like some more information on breast cancer?
sure.
All right. Well, I'm Christy. I've been a nurse for about 8.5 years, and I've actually went back to get my bachelor's, so I've got to do a community project. And since it's Breast Cancer Awareness Month, I'll talk to you all today about breast cancer. All right. So we have to ask ourselves, what is breast cancer? Well, it's where your cell has a defect, and it gets it keeps multiplying, and you wind up with a tumor eventually. And as you can see, these cells, this is a normal cell, and then these are cancer cells that actually break away and go into your lymph system or your bloodstream, and then it can spread to other places.